Thank you.
Next, we're going to have Josh Stanley and Jill Haus, a parent. Please come forward.
Do you want to hit and I'll just go? Sure.
Let me introduce you.
Representative Birch, I would like to thank you for allowing us to come before your committee today, and I'd like to thank all the other committee members here before us, and thank you for allowing us to speak about this important topic here. My name is Jaime Montalvo, and I run...
Would you please identify yourself
Yes,
first?
sir. My name is Jaime Montalvo, and I run Kentuckians for Medicinal Marijuana here in the state of Kentucky. We are encouraging citizens to contact our representatives and state senators in regards to the legalization of medical cannabis across the state. I want to touch on something that Representative Wade brought up just a few minutes ago. He was talking about how so many things here in the state have so much regulation and red tape. This one thing that we're talking about here, medical cannabis, has absolutely no regulation right now. Patients do not have a safe place to go and acquire their medicine. There is no regulation stating where to go. There's no regulation saying, the quality of the product that you can purchase. And I think that that's something that we need here in the state so that patients can have safe access to an effective medication that's been studied by quite a few different countries and different facilities. We've proposed a bill through the Senate and Perry Clark which would regulate the system robustly as the federal government has required through the Department of Justice Cole memo. And I have provided you a copy of the Cole memo so that you can look at the different stipulations that the federal government is looking for in the state programs so that they will not need to intervene. And I believe that the bill addresses these 8 different stipulations very well. It will keep the products from getting into children's hands, and it will keep the product in the hands of the patients that truly need this safe, effective medication. And with that being said, I'd like to introduce Mr. Josh Stanley, who is the founder of Realm of Caring and has studied cannabis intensely at the national level and has been fighting to legalize all over the country.
Thank you very much. I'm Josh Stanley, and first off, it's an honor to be here to address the committee here in Kentucky. Kentucky has some very, very vital and important decisions, I think, to make here in the near future. As you're starting to see medicinal cannabis, industrial hemp kind of go hand in hand, as well as recreational, which is happening right now in Colorado and Washington. These are issues that Kentucky, like it or not, and I think we can have some levity as we move into some of these discussions, is coming. And I think it's going to be a matter, I know it's going to be a matter of how is Kentucky going to handle this? Are they going to implement and put together a responsible regulatory system, or is it going to run rampant? The use of medicinal cannabis is going to continue to rise, as we'll get into here in just a little bit. But what I'd like to do is I'd like to go through a brief history, a little bit of an education, a medicinal cannabis 101, industrial hemp 101, talk about some of the studies, both nationally and internationally, that my organization is involved in, and then talk a little bit about some of the benefits to this here in Kentucky. Okay, cannabis itself, the plant, it's one of the earliest domesticated plants. It dates back 12,000 years based on carbon dating, and there are 3 primary strains. There's indica, sativa, and ruderalis. As many of know those, most people understand medicinal cannabis to be an indica or a sativa. The indica plant primarily comes from the mountains in the Himalaya. It's traditionally a smaller plant. We've been doing a lot of different types of research studies in the indica plants on certain types of cancers, varying ratios in that regard. The sativa plant is a longer plant, taller plant, primarily coming from a tropical region, and so it grows. Its evolutionary growth has started in a jungle where it has to reach and stretch and compete with other foliage. So looks completely different. The sativa plant, we're also undergoing different studies and cancer studies as well as autoimmune dysfunctions. And then ruderalis is commonly known as industrial hemp. Industrial hemp is something that I think is on everybody's tongues here in Kentucky, and we'll kind of get to that here in a little bit. The difference between hemp and cannabis, really it's simple. It's just the usage. Industrial hemp has a variety of usage. In fact, you can use the whole plant. Industrial hemp actually is able to put nitrates in the soil, has been used to clean up soil for, when certain types of pesticides and carcinogens from crop dusting and things of that nature. In fact, Hawaii right now is undergoing a study on hemp as basically a biosponge for a lot of the land there, being an island that has been misused. Hemp can also be used obviously for papers, foods, textiles, biofuels as well. Cannabis, I don't think that needs any introduction. Cannabis is either smoked, vaporized, ingested. The primary way that I advocate for is obviously through lab-tested, high-pressure liquid chromatography, very tight controls and procedures as far as intake and dosing and so forth, which again we'll get into. There's an incredible number of uses for this plant, so I don't think we need to labor on this issue. The sad part is, up until now, all of these claims have been anecdotal, at best, anecdotal. There's no scientific evidence leading up to this. Well, why is there no scientific evidence leading up into the year 2014? Well, because the NIH, the FDA, they don't approve studies, even on a university level. And if they do approve studies, then they're studies that they hope will have a mal-outcome. We've seen this over and over and over again, but we've also seen the NIH and FDA proved wrong in 100% of their studies. So we're starting to move into the validity of these things through courageous states like Colorado, where I come from, who have stood up and said, no, this is actually good for our state. We want to study this. We want to see its effects both on the economy and also on the health of its citizens. And to that extent, many other states have followed in responsible regulation, and being Washington, Oregon, and 21 other states. And I think we're going to see in 2016 a real tipping point to that 26, 27, 28 state here in the United States that are moving either to legalize or to pursue medical options as well as industrial hemp options. Okay, most people believe that marijuana was made illegal through a process, through a scientific process, through some type of a benefit analysis that told us that cannabis was harmful to our health. This is not true. Cannabis was actually made illegal in the 1930s because it directly affected the cotton industry and the paper industry. If you look back in history, you see that the DuPont family owned or had the monopoly on the paper mills in the United States. It was quickly learned that private entrepreneurship was really coming about in those days as corporate conglomerates started to take hold, and coming out of the Depression of 1929 and moving into the dirty 30s and the Roosevelt era of the Works Progress Administration. And competition was on the horizon. So William Randolph Hearst at the New York Times began to publish stories demonizing the effects of the marijuana plant, and when in actuality it had nothing to do with the actual benefits or mal-causes thereof. They found out that you could grow a hemp stalk about this big around in 9 months, where it took 9 years to grow a pine tree to that size. And it was also more sustainable, longer molecular fibers, and could be used for a variety of different things. It also competed with the beer and alcohol industry, and as you know, it just come out of the Prohibition era of the 20s. So the plant has been demonized for almost the last 90 years, and we've really bought into that. We've bought into that propaganda. And you know, it rightfully so to some respect. I mean, when this is being talked about, certainly by medical professionals for the last 90 years, lawmakers for the last 90 years, the public is going to tend to believe these types of things. Gateway drug, all of these types of propaganda. But we're starting to come out of this now. We're coming out of this notion as a nation, and we're doing this really collectively. We'll get into some numbers here, but I think it's important to note that more Americans now believe in not just medicinal, that's polling at about 78%, but in recreational use, the poll last week was 55%. So medicinal cannabis is on the rise. There is something going on here. There is a therapeutic benefit, and I truly believe it's coming to Kentucky, or I don't think that we would be here today talking about that. So what are cannabinoids? We're going to get into a little bit what is it in this plant that's causing all this stir? What is it in this plant that seems to be working so well for a variety of different illnesses? Albeit anecdotal. Well, cannabinoids are the compounds that are found in the cannabis plant. So far, there are about 120 different compounds or cannabinoids that have been identified. These are just molecular compounds. The two most primary parts of the plant, the two primary compounds are tetrahydrocannabinol, which I think everybody understands as THC, referred to sometimes as delta-9, which is the psychoactive portion of the plant, or the portion that provides the euphoric or the high, if you will. And then there's cannabidiol, or CBD, the two most prominent, both diametrically opposed to each other. Cannabidiol, again, being non-psychoactive, very little had been done or researched on cannabidiol. The very interesting thing we'll talk also about is that all mammals, every one, has what's called the endocannabinoid system. The endocannabinoid system was just found and discovered in 1991. As I mentioned earlier, very, very little research has been done on this topic, but until basically now. The endocannabinoid system is like a lock and key system. And it's no wonder why the cannabinoids, okay, are actually bonding to this system, which is why we're seeing such intense medical therapeutic effect through a nutraceutical. I'll try to stay away from using the word medicine and use more words like therapy, natural therapy. And really in the words of people like Sanjay Gupta, who we work very closely with and working on a new documentary, this is really the first time that we're staring down the pipe of a nutraceutical surpassing, in many, many cases, the efficacy of FDA single compound pharmaceuticals. It's the first time that we've seen a situation like that in history, and I think that's why a lot of pharmaceutical companies are now beginning to stand up and take notice, most notably GW Pharmaceuticals. A little bit about cannabidiol here. Cannabidiol possesses a wide range of benefit. I began studying cannabidiol and studying research documents out of Israel, out of Portugal and Spain primarily. About 10 years ago, started to get into these studies and started to research these studies on kindled rats that were kindled with a variety of conditions and diseases. And at the risk of sounding like a snake oil salesman, everything that I will talk about, we are proving in our laboratories in Jerusalem and in Tel Aviv, and also now soon to be the University of Utah. Cannabidiol was found in 1949, though they didn't know what it was, to be an incredible anti-seizure, anti-epilepsy compound. In fact, it was even published in the Salt Lake Tribune in 1949. And after that publication, it was tabled. It was shut down and no research had been done to it until a couple of years ago. The effects of cannabidiol are clearly evident in our studies conducting now in Tel Aviv and in Jerusalem in the area of diabetes. A very little known fact in a country, we're actually working with countries on this now, a country like China has an epidemic of diabetes type 2. And they found that to be the cause of a refined rice that the Chinese are unable to process. And in kindled rat studies in our lab with our scientific partners in Tel Aviv, they've been able to successfully revert type 2 diabetes using cannabidiol back to its original blood state. So the Chinese are very interested, obviously, in staving off the upcoming epidemic for providing cannabidiol-type treatments for the Chinese people to stave off that epidemic and using it as a preventative. Certain types of cancers are also being treated effectively in kindled rats as well. Probably one of the most unique situations that we can really get into and we can show pure efficacy is in our most recent study here in the United States, not on kindled rats, but on humans. I want to introduce you to a little friend of mine. Her name is Charlotte Figge. Charlotte was 5 years old when her mother called us at the end of February 2012. We had just been successful in breeding a medicinal cannabis plant that was very, very high in cannabidiol and extremely low. In fact, so low it would fall into the UN standards and U.S. Department of Agricultural standards as to what hemp would be. And her mother had called us, and we were about to start a study on adults. And she said, "You have to help my child. She's 5 years old. She suffers from a syndrome, a very rare and violent form of epilepsy called Dravet syndrome." Dravet is an intractable form of epilepsy that, unfortunately, and to speak hard facts here, most children don't see their teenage years. Charlotte certainly wouldn't. Charlotte was sent home with a feeding tube in her belly and a fitted wheelchair, and she's exhausted 18 different pharmaceuticals, many of which weren't FDA approved, but were approved for veterinary use in France. And her parents, Matt and Paige, signed a do not resuscitate order, and they were saying their goodbyes to Charlotte. So after meeting with their neurologist at Children's Hospital and going through the necessary protocols to treat especially a 5-year-old with cannabis, that seemed a little odd. We decided to move ahead with the treatment with Charlotte. Charlotte's first week, well, let me get to that. We originally named the strain. We didn't know what to call it because nobody wanted the strain. We operate dispensaries, my family, my brothers in Colorado, through use of non-smokables and dosed, and we do our testing that way. Well, we have a compound and we have a plant here that nobody wanted, so we named actually the plant the Hippie's Disappointment because there was no psychoactivity to it. There was no high. We couldn't sell it. It sat there, and so that's when we knew we had to get a study going. So I wanted to back up and be able to say that as well. So Charlotte was the first treatment, and Charlotte was having 350 to 400 grand mal seizures a week. To put that in perspective, that's about every 25 minutes. Now, these seizures will last for 15 to 20 minutes. So essentially, little Charlotte lived her life in a catatonic state. And Charlotte's not alone. Thousands of other children suffer from this. So Charlotte got approved for the treatment through the necessary channels. In her first week, Charlotte went from 356 the previous week to 0 the next week. In 1 month, Charlotte will be 2 years on the medication, and Charlotte is still 99.7% seizure-free. Charlotte went from catatonic, obviously lost all of her skills, couldn't speak, couldn't walk, couldn't talk, couldn't eat, and now she wants to be a ballerina. Charlotte's not an isolated incident here. Zakai was our second patient. Zakai suffers from a rare form of epilepsy known as Doza syndrome. Zakai was having over 200 subclinical seizures a day, lived in a catatonic state, and when we met Zakai Jackson and his family about 2 months after Charlotte, he was in hospice. He was in palliative care, and the family was again saying their goodbyes to Zakai. He had lived this way for 10 years. Zakai was 10 years old. Back in October, I can tell you that we celebrated Zakai's 1-year seizure-free anniversary. And even his epileptologist says if I hadn't known this boy to be severely epileptic, I would tell you that he does not have epilepsy. Again, not an isolated incident. We are currently treating 300 children in Colorado, 10 of which shamefully so, have moved from Kentucky. All of the 300 have moved from somewhere. We already have the people in Colorado. 300 families moved from all over the world. This is unacceptable. It's unacceptable as humans, okay? Especially when we're talking about such a benign substance here that hasn't killed anybody in 5,000 years of recorded history. For a parent to stand across an invisible border and a boundary that we call a state and watch their other children get well and know that there's nothing that they can do for their child because they live in Kentucky or they live in Kansas, it's unacceptable. Something has to happen in that regard. So we started an organization called the Realm of Caring Foundation, and now another organization called Strains of Hope. This organization is run by my brothers who treat these families. It is nonprofit. We do strive to keep this medication extremely affordable. Through our organizational efforts, we've been able to help craft legislation. I actually was able to author House Bill 1284 in Colorado and co-author the cleanup bill, House Bill 1043, the full research and development portion, which has allowed us to get to this point to understand why this plant is doing what it's doing. And I really think it's important here. I want to add that we're not just talking about childhood pediatric epilepsy. We're also talking about autoimmune dysfunctions, cancer, diabetes, arthritis, depression, PTSD, Parkinson's, ALS, MS, Alzheimer's. And in autoimmune diseases in our laboratories and with our scientific partners who are actually a part of my team now, the same scientists that I was studying 10 years ago, Dr. Raphael Meshulam, Dr. Mark Rosenfeld, Dr. Ruth Galili out of Jerusalem, we're actually showing that we're not able to reverse, but we're literally stopping the progression of Parkinson's, Alzheimer's, ALS, and MS through the use of the cannabidiol treatment. So I don't want to soapbox here and so that you think that all we're talking about here is epilepsy. That should be enough, certainly, but we're just getting warmed up. And when I first started and got into this industry, and I want to address something that I think is a sore spot to Kentucky. When I first got started in this industry, I started a program for veterans. It's shameful and disgraceful, our situation right now and how these veterans are treated. Never in history have we ever seen a suicide rate surpass the mortality rate in battle of veterans. Shame on us. Yeah. And furthermore, what are these deaths attributed to? Primarily opiates. You have a real problem in Kentucky with opiates. We do in Colorado as well, obviously not isolated. I started a program for veterans that could come in and see a Colorado abuse counselor, level 3, who donated her time to come in and sit down and counsel these veterans to come in and trade in their opiates, which would be destroyed, for cannabis oil. An incredibly successful program that we're still trying to work on in practice today. And what I hear constantly, and the pushback is from drug and alcohol treatment centers, that this is a gateway drug. This is this is harming our youth. But the simple fact of the matter is show me the proof. No one's yet to prove that this is a gateway drug. I mean, maybe in a recreational sense, maybe gateway to the ice cream store. So certainly you can't tell that to a little girl like Charlotte. You can't tell that to people who have gone overseas and have died. You can't tell that to people who are suffering from cancer. Anything, in my mind, but a gateway drug. So when I talk to these drug and alcohol treatment counselors from California, from Washington, from Colorado, what is your biggest concern, I ask them, with cannabis? And the answer is that they wish they could prescribe or recommend cannabis treatment in place of methadone. So all they're doing is replacing one evil for another. And then you find yourself, these states, in these situations where you're actually playing whack-a-mole. You have an opiate problem, a clear opiate problem here in this state, and so you go after the opiate problem and the pharmacology issue, and then heroin springs its head up. And then you go after heroin, and then vice versa. And so you find yourself chasing instead of inserting a possible solution here. So all I'm suggesting is that this is a possibility, and to be open and be mindful of that fact. Now, the way that we make our oils is I think very important. And as far as standard operating procedures go, we operate as if we were under the auspice of the DEA or the AMA or the FDA. Our equipment is certified. It's high pressure liquid chromatography that we do our testing with, and our extractions are pure. We operate as if we were under the same protocols of Pfizer, Eli Lilly, or Merck. And we teach others how to do this as well. This is not a case of a monopoly. We're trying to educate and spread this and bring these good practices into these new states that are adopting responsible regulations. I kind of jumped ahead of myself, and I get a little bit excited, especially when I talk about these families. Let's talk a little bit about THC. THC is, as I said, the other primary cannabinoid. This is the intoxicating one. This is the scary one. Okay, this is the one that typically light bulbs turn off when you start talking about this. The reality of this situation is that THC is incredibly beneficial. THC in certain studies is showing incredible anti-cancer properties, anti-nausea, sleep aids, pain relievers. THC has been a godsend to many, many, many of our veterans in Colorado who have been able to substitute the use of this for opiates. So THC kind of gets a bit of a bad rap. And you know what? Somebody going through cancer, chemotherapy, I don't think there's much wrong with giving them a little bit of a lift and giving them a little bit of a break of reality. You know, I had an 82-year-old woman suffering from cancer walk into our clinic one day, just embarrassed as she could be, and she said, "I just don't know what to do anymore. I am going through chemotherapy, and it makes me so nauseous that I can't eat, and the anti-nausea pills take away my appetite." So she's literally starving from the inside. And so should we take her into a little bit of a cannabis education, and it got her through her chemo. She put on 20 pounds in 2 months and was back to herself again. Now, she didn't make it, but she had a better quality of life. And isn't that what we're all about? I mean, we should be. So, you know, THC does get that bad rap. When we talk about the safety profile, the safety of cannabis, we can talk. The safety profile is not even worth mentioning because it's off the charts. But to give you some type of a perspective as far as the safety of cannabinoids and cannabis is the safety ratio, meaning how many pills that you can take and to potentially overdose. Percocet 1 to 10, Vicodin 1 to 12, morphine at a particular dose, of course, 1 to 6, and cannabis is 1 to 10,000. Meaning I could put you in here with a bib and a knife and a fork and bales of marijuana and let you go at it. You may feel like you want to die, but you won't. It's never happened. So to discuss the safety profile of this, it can't be overstressed. When we're talking about the number one cause of death in the United States, we're talking about alcohol. When we're talking about tobacco, nicotine. Why in the world are we sitting here in 2014 having to discuss and try to defend helping people and bringing about a natural whole plant organic compound for our health and our kids' health? Oh, I do have to touch on recreational use because recreational use is it's coming. It's coming to the United States, and it's coming fast. In this next general election, I think that, like I said, you're going to start to see these tipping points. People, the point is, people are going to smoke this. People are going to use this, whether or not it's legal or it's illegal. It's up to a state on whether or not they want to create crime, or whether they want to reduce crime, and whether they want to profit, or whether they want to continue to fill their prisons. Prohibition hasn't worked. We've seen that with alcohol. We've seen that throughout history. In fact, you can see that when you go back to the first lesson of the Bible. I don't know what's so difficult about this. Remember? Hey, kiddos, you can have whatever you want. Take your pick. But this? Don't touch this. They didn't care about anything else. They had to have that. That's human nature. We've seen that repeat itself over and over and over again. What happens when we accept When you leave humans to their own volition, you might be surprised, and you often are. It's the reason that Europe doesn't have a problem with underage drinking. Why? Because they can. Because it's not taboo. At what point in time are we going to stop trying to legislate morality? This is it's really gone too far, but we're seeing the shift now. It's happening. And you know, I couldn't be more proud of precious children like this and precious courageous mothers like this who are standing up and saying, you know what, enough is enough. I'm going to do what's right, period. And you know the one rule of nature, I don't think I have to tell you all and the mothers here, but you don't poke the mother bear. And I'm proud of you for standing up on this. Yeah,
we want to hear from Jill.
I'm sorry, Representative. I will wrap up. A few closing comments, if that's okay. Back when I started in Colorado, I was the second to open in Colorado, and I went to 22 places during the recession. I think you all recall, and 21 told me to get out, and one person said, "Okay, perhaps." 6 months later, all 21 of those called me back and said, would you please lease my building? Now we're sitting here 5-6 years later. There isn't a vacant seat to fill in Colorado from a retail perspective or a commercial real estate perspective. Colorado was at a $270 million deficit. Next year, we're going to be looking at a surplus. Crime has gone down and even health has gone up, all because we've stopped legislating morality. It is coming, and this can greatly benefit the great state of Kentucky. I'm confident that it's going to, and I'm confident that right rules and responsible regulation are going to be put in place to do just that. Thank you for letting me get so long-winded. I sure appreciate being here today.
Thank you.
I was really nervous about testifying today, but after hearing him speak, now I'm just kind of revved up. My name is Jill Haus. That's my daughter Sylvia over there. Before I begin my testimony, I first wanted to take the opportunity to say thank you to any of you here who have supported and influenced the Kentucky government programs, such as First Step Early Intervention programs, Michelle P. waivers, and other Medicaid waivers. They've saved my family from crisis over and over again, and it's a way that you're protecting some of Kentucky's most vulnerable citizens, and I wanted to say thank you first for that. But now on to why I'm here today. Like I said, this is my daughter Sylvia. She's 4 years old. She loves a lot of things that a typical 4-year-old does. She loves to play, laugh, cuddle, swing, dance, but these activities are often interrupted by seizures, neurological irritability, and the fact that she cannot walk, talk, eat, or sit up and hold her head on her own. She functions basically as an infant. She started having seizures at 4 days old. When she was born, she was pronounced healthy. We've had every test, biopsy, EEG, MRI, CAT scan, genetic test that you could think of, and no one's ever been able to give us any explanation to why Sylvia suffers the way that she does. Since birth, she has tried phenobarbital, Keppra, Depakote, zonisamide, Klonopin, Topamax, Sabril, Febitol, Triliptal, Valium, Ativan, as well as ACTH injection treatments, ketogenic diet, and also has had a surgery to place a vagal nerve stimulator implant in her chest to control her seizures. If you counted, that's 12 drugs. None of them have worked. None. Despite treatments, she currently experiences hundreds of seizures a day. Her seizures right now are not grand mal seizures, although she has had those seizures in the past. Each seizure that she has damages her brain function, inhibits her development, and her prognosis is not good. I discovered medical cannabis after talking with one of the families that Josh had mentioned who's moved to Colorado. Erica Rollins is the mother, daughter, a little girl named Emily. We've been friends on Facebook for a long time because our daughters are so similar.
All persons not entitled to privileges on the floor of the House
they share the same symptoms,
under
and
the
also
rules
they
thereof.
have never been able to get a diagnosis for their daughter. They began CBD treatments and have seen amazing results. Her seizures are down by 80 to 90%. She's starting to develop some skills that she hadn't developed before, and I think the most beautiful thing for their family is there's less time screaming and crying and more time smiling and giggling. It's like the most important thing for any parent. After hearing about this from Erica and their daughter Emily, I started finding other families who are using this treatment. Found more and more amazing stories. I communicate with a pediatric medical cannabis support group on Facebook that has 3,000 members, all parents who are seeking treatment for their children. My main point that I wanted to make today is that parents need something other than anti-epileptic drugs. The drugs that are available to us now can be very effective for some people with epilepsy, and the goal of a neurologist is to get maximum seizure management with minimal side effects. Children like Sylvia never get close to this goal. All of the drug treatments that we have tried, all but maybe one or two, the treatment is worse than the disease. The things that these anti-epileptic drugs have done to my child, I sometimes have felt embarrassed that I have given them to her, but I have no other choices. That is what I'm faced with every day of my life. Do I try to use these drugs that are not tested in children? They have can cause massive and severe liver failures, permanent vision loss. I mean, these are the risks that doctors are willing to take to try and stop the seizures in my child. And they don't work. They cause horrible side effects. One of the injectable drugs that Sylvia was on caused her to gain massive amounts of weight in her face and her chest. The only thing that would calm her, she was a 9-month-old child, the only thing that would calm her would be to sit her in a dark room all alone by herself. These are not the kinds of drugs that we should be giving children, and parents should not be faced with those types of decisions. I could go on, but I think you get the point that all of these treatments were prescribed by her doctors. They determined that the risks were worth the potential benefits of controlling the seizures, and we took the risks, and none of them paid off. We are out of options. So for Sylvie and all of the others in our state who are suffering and out of options, you can help us create another option that might change our lives forever. Please support legalizing medical cannabis in the state of Kentucky, and please do it quickly. What if Sylvia responds to this treatment? I think of this every day when I try to decide if I'm going to uproot my family and move to another state. What if she can learn to sit up on her own? What if she learns she can point to something that she wants? What if she learns that she can look at me and smile or hug me back when I hug her? What if she gets to live a longer life, a happier life with less seizures, becomes more independent, and is able to stop taking drugs that cause these horrible side effects? But also consider, what if you do nothing and you decide that medical cannabis is not for Kentucky? I want to think of that future for a second, even though that's the future I try to not think of every day of my life. My daughter keeps having hundreds of seizures a day. She continues to be developmentally an infant. She continues to need expensive drugs, expensive therapies, and round-the-clock care. She continues to wake up at night screaming from her seizures, and her brain slowly dies away until there's not enough left of it to allow her to breathe, and she fades away. You can give her a chance to have a better future, and I will gladly answer any questions that you might have about why this is the treatment I feel is the best for my daughter. And I'm willing to share my story with anyone who has any doubts about supporting medical cannabis in our state. Thank you so much for listening.
Thank you.
Mary Lou.
Thank you so much for coming and sharing your stories. I'm up here. And thank all of the audience for coming. And I tell you, you all are a force to be reckoned with. I've gotten more emails on this than anything, and I thank you for those. So.
Representative Birch, can I have one more minute of your time, sir? I have a family that was introduced during the August meeting that actually had to move to Colorado in order to gain safe access. This Bird family has actually, that is her last name, the Birds. They were introduced by House Representative Stacy during the August meeting, and shortly after it, at the end of October, had to move to Colorado in order to gain safe access for their child, Charlie Bird. And I would like to just take one more minute of your time so that his father can explain the medical benefits that his son has received after moving to another state, uprooting his family, and actually, moving to another state to receive this safe, effective form of treatment. Can we take one more minute of your time, sir?
Just one.
Okay.
Thank you very much. I will be brief, because I'm cried after listening to what she said. This is the choice we have in Kentucky, to leave our family, our churches, our careers, to leave the life I've known for 35 years. I chose to do that. Other families here will choose to do that if you do not pass these laws to allow medicinal cannabis. And I know it works. My son went from 30 seizures a week. These seizures would last 40, 60 seconds on average. When we go to status events, we were in there for 20 to 30 minutes in an ER, flown from West Liberty, Kentucky, to University of Kentucky, to Cosair in Louisville, to Cabell Huntington in West Virginia, to Vanderbilt in Tennessee, to Memphis in Tennessee. I've been to them all. We've been to neurologist. Nothing has worked. 10 different medicines, most of which Jill listed. None of them worked. There's not one medicine that we give to our child that's approved by the FDA for pediatric use. One of his best medicines that we get from France. It's not even FDA approved in this country. Through the Compassionate Use Act, we're allowed to get that through his hospital. None of these treatments worked. Since we've been in Colorado, his seizures, as I said, went from, on average, 20 to 30 a week. We're seeing about 10. His seizures that were lasting 40 to 60 seconds on average, but upward in the minutes, we're seeing about 5 to 10 second seizures. We are at 50% therapeutic level, so we've got some way to go. And when you're talking about a dosage that Mr. Stanley mentioned, this is what you're talking about. A 1 milliliter syringe, this is empty by the way, 1 milliliter syringe, I give my son Charlie 2/10 of a milliliter. You're talking just a few drops underneath his tongue 3 times a day. That's all he gets. Since doing this, the seizures have decreased. But more importantly for us, as parents, the cognitive development. He looks me in the eyes. When he talks. He don't just blubber. He actually communicates with us. A parent that has never known the joy of that is amazing. To see your child actually communicate, like I said, mine's 5. He's probably about a 2 to 3 year old level because of his developmental delays. But to see his eye contact now, his focus, his fine motor skills have improved, his balance has improved, his gait has improved. Every cognitive development delay, he's improved it. And the seizures are getting controlled. They're not there yet.
We're going to have to go into session here in about 15 minutes. So, and Mary Lou didn't finish her question.
Well, I didn't really have a question. I just had a comment. Just thank y'all for coming. And I'm for this 100%. This is about giving folks options. You know, what have we got to lose? And it's about quality of life for our Kentucky citizens. And I certainly don't want to lose anybody else to Colorado. We need to keep you here. So thank you all for coming, and I pledge my support.
Thank you.
Hold on. We got a few more questions. Robert.
Thank you, Mr. Chairman.
And then
Look, my first comment is this. Thank you to the parents who are willing to sit up front and tell their stories. Very difficult, but for the grace of God, go all of us. And we are mindful of that. I know I am mindful of that. Let's try to bifurcate this. We've had, I think, a decent medical discussion. And then we jumped into recreational use. So for those of you who want to convince me that there is a medical benefit to cannabis, don't put the word recreational use when you come and talk to me, because I do not believe in recreational use of marijuana. And I could likewise fill this committee room with first responders, law enforcement officers, and parents of dead children based on the effects of marijuana, of driving intoxicated in child abuse. We already heard today from folks who talked about intoxicants and its role in child fatalities and child abuse. So we need no more recreational drugs in Kentucky. We have been decimated by opioids. We have issues with alcohol. We have issues with diabetes and heart disease from smoking. So now let's talk about the medicine. And let's talk about getting the right folks in the room, university presidents, our board of pharmacy, our board of medicine, and let's talk about a discussion with the FDA about how we can have supported clinical trials in Kentucky. If that's what you want to get at. If not, what we're going to do is we're going to end up with a system that has absolutely no function to be able to say with any kind of reasonable certainty without going through stage 3 clinical trials when this might be helpful, in what dose, in what form. And that's what we have to get at. And look, with all due respect, you don't have any FDA-approved clinical trials relative to cannabis. And we ought to make sure that we do not use this as a Trojan horse to legalize recreational use marijuana. So for the folks, look, there are processes to work with the FDA to expedite clinical trials. And if that's where we have not been good at as a country as a whole, then that's what we need to focus on, to see if there is any chance that this could provide relief to people who are suffering. But what we can't do is simply open the floodgates and create a different kind of suffering that Kentucky has already seen over and over again. So we don't, in an effort to get at one person's suffering, we don't want to cause more suffering. We have to focus on the folks who this truly might help. But we have to have the scientific evidence behind it, and we have a long-standing process in this country for determining that, and it's called FDA-approved clinical trials.
Hold on a minute. That's
ma'am.
Ma'am, we can't, ma'am.
I understand, but again, we have a process. Let's focus on that process to make sure we don't do more harm than good.
Robert,
thank you.
Representative Wade and Representative Moore, and that's it.
Well, I want to thank Josh for coming. Josh, you have informed me in great depth. I have to admit I'm a little impatient with how long-winded you were today, on a day when we were trying to get a lot of people heard. And a lot of people are here because they want to be heard and they want to make sure the message gets through. But in the process of your discussion, I have learned things I didn't know before. And I have friends who suffer and who have told me personally about the benefits that they have achieved when they've gone someplace else and taken advantage of this substance. Now, I want to approach this from a little different angle here. I think that the results that you're presenting to us are astounding. And I'm not only sympathetic to my friends, but I'm sympathetic to the kids. I'm a healthcare provider, and if there's a better way to relieve pain for people who have cancer or people who have MS or kids who have seizures, I think we ought to be all about pursuing a process of getting that approved. If you want the people of Kentucky to embrace that, I want to echo Representative Benvenuti's comment. Don't come in here and mix recreational use with what all these parents are talking about. Don't do that, because it diminishes your argument and it weakens the argument. When I go back to my county and try to talk to people about the benefits that you just described.
I agree.
So I'm very sympathetic, and I want you to know that. I'm curious, though, as to some of the comments you made. I want to get some better clarity, because you said that the FDA will not approve studies for this. Don't answer yet, because I want to get through my comment here. And then a few seconds later, you said, and then 100% of their studies have been proven wrong. Well, if they don't approve studies, how can 100% of their studies be wrong? And then you commented several minutes later about government studies that show that you can't overdose. So if there have been no studies and they won't approve studies, and you're saying none of the studies are valid, and then you say studies show that you can't overdose, I legitimately get a little confused. And so I don't want to take up our time here, but that's some of the hill that you have to climb, because people in Kentucky are hungering for legitimacy with this issue. They're hungering for solid medical evidence that they can wrap their arms around and say, yeah, this is okay. Because public perception is, and reality is, we do have a substance abuse problem in Kentucky. And we do have a public perception of what marijuana and cannabis does and is. If you want to change that, if we're going to make a better way for people to stop suffering, then, explain to me briefly, what's the disconnect here with your comments with the FDA, and why won't the FDA do this? I understand the FDA does not welcome everything, but can you in 60 seconds tell me about that disconnect?
Yes, I misspoke. It's very simple. I meant NIH when I said FDA in regards to that. So I meant National Institute of Health and also NIDA. So I did not mean the FDA. The FDA does not approve those studies. It is the NIH. And so what I was talking about, the most recent study was done by a researcher at UCLA who studied a control group of patients who used marijuana and also used cigarettes, and then ones that just used cigarettes. And what their outcome was contrary to what they believed it would be, and they quite frankly, they ruined this scientist's career because they didn't come out with a study. But you can go read it on PubMed. So there's been a number of those studies done in the United States. Now the studies have stopped. So in reference to you, Benvenuti, and both as well, representatives, is the FDA is not going to approve in the United States studies for this, because we're talking about, let's be honest, a Schedule I narcotic. We are putting together studies. It's not just me. I have a team of Harvard physicians. I have a team of Harvard researchers. I've got the world's top cannabinoid scientists that are working on my team and working with this, and we're developing placebo-controlled trials in line with FDA standards. So if they're not going to do it, somebody has to. And I wasn't able to get that out, but we are conducting those studies. We're working directly with the world's top practicing neurosurgeon, Sanjay Gupta, to better understand this endocannabinoid system and how it's connecting in this regard.
Well, I can assure you we're not going to talk about recreational marijuana.
I'm not talking about recreational marijuana.
Well, Josh, we're running out of time, and Representative Moore has another question. So thank you very much.
Answer your question.
We got one more question, then we got to go out here. We got to go to work.
I'll be very quick. Just a couple of questions that very short. When did Colorado sanction medicinal marijuana?
In the year 2000, it was a matter of it was a constitutional. It was a ballot initiative, and then it was further defined by House Bill 1284, which
was your organization, are you personally involved in that effort to promote medicinal use back in 2000?
Yes.
And were you involved, or your organization, in the sanctioning or advocacy of the open use of recreational marijuana this past year?
No.
Okay. Are all prescription drugs in Colorado taxed?
No.
But this one is?
Yes.
I think it's sad that we have many addictions in Kentucky. They've already been mentioned. Our state has had a dearth of drug use and addictions in that regard. We also, unfortunately, seem to be addicted to money in terms of revenue, and trying to appeal to that addiction by promoting the revenue stream that this could promote mixes a message as well. Because if that's what we have to do to convince ourselves to support families, shame on all of us.
Sad.
Okay, but I would submit to you, sir, that as has already been said, the message has been very mixed this morning in the direction of endorsing medical marijuana, which I would not be opposed to either, especially in the case of children. Someone's leaning on our light switch.
Keep talking.
Is harmed tremendously when you make the declarative statement that recreational use is coming and that we can benefit from it in terms of our revenue stream. That is something that is an anathema to many of us on this panel, and I assure you in the General Assembly. And the devil is going to be in the details. I would very much advocate the baby y'all are proposing, but you bring an awful lot of bathwater, which you don't even want to discuss. And the detail that will be involved in trying to separate the two of those in a bill will determine whether or not it passes. Because right now, as we heard testimony last year of what would constitute a medical need, everybody in this room and beyond, I assure you, would qualify for what was being proposed as medical use. That does not fly. That does not meet the common sense standard. That does not meet the standard of us wanting to care on a human and emotional level for those who are truly in need. So therein lies the challenges. I don't know if the good senator is here to hear some of these concerns, but that's what we will continue to discuss. I do appreciate y'all coming. I appreciate the concerns of the parents in this room, but there's a lot more work that needs to be done to separate the two. Thank you.
Thank you.
Thank you.
I want to thank you all again for coming before the panel, and thank you for your information. I think you've helped us a lot in the cause also. And this will be back before a committee. If the bill is introduced, it may not end up in this committee. It may be in judiciary or somewhere like that. But at least we're going to be having hearings on it. And I don't know how many of y'all survey your district on this issue, but mine's coming back about 80%. For it. If there's a motion to adjourn, I'll entertain it.
That was hard.